Hello, everybody. Welcome. Welcome, everyone, to this meeting. My name is Vanessa Maydew. I'm the Communications and Knowledge Exchange Specialist for SEBI Livestock, the Center for Supporting Evidence-Based Interventions in Livestock, which facilitates the Livestock Data for Decisions Community of Practice, or LD4D. Some quick tips before we get started. If you can rename yourself with your full first and last name and organization so we know who you are. To do this, open the participants list in Zoom, hover over your name and click more. You're welcome to have your video on. We would love to see your face, but we will keep you on mute until discussions begin. And of course, you can use the chat anytime for questions and comments. We'll try to get to these throughout the meeting. So as you probably know, today's session is part of our annual community meeting, which has been taking place all week. We have had a really exciting program of webinars and workshops on all kinds of livestock data topics. And we have one more topical session tomorrow on early warning systems for pastoralists. So do join if that's a topic of interest to you. And of course, our closing session, where you're all welcome to come and give us your thoughts and feedback and guidance on ways forward. So before we begin, we just want to know who's here. If you want to take a moment to say hello in the chat. And I will hand over to Joanna Wong, who will introduce herself and the session's objectives and agenda.
Thanks, Vanessa. Welcome everyone to today's gender session, looking more closely at who benefits in livestock projects, with a focus on service providers for this session. My name is Johanna Wong. I am SEBI Livestock's Monitoring and Outreach Officer and part of the Secretariat of the Gender and Livestock Data Community of Practice. I am joined by my SEBI colleague Fiona Allen and SEBI and IFPRI gender and strategy experts Beth Miller, Annie McLeod, and Alessandria Gallier. We have a really exciting lineup of speakers today, starting with Hazel Malapit from IFPRI, who will present on the Reach, Benefit, Empower, Transform framework, so we can understand what we mean by who benefits. Following Hazel, Jenny from EU FMD's Veterinary Paraprofessionals Project will then talk about how they've considered benefit when looking at veterinary paraprofessional training. Through these presentations, we will hear about the importance and utility of qualitative data collection and analysis. So Katie Adam from the University of Edinburgh is going to give us a taster session on qualitative research, and we'll watch a short teaching video filmed by Gretchen Walsh. So I know that people may be introducing each of themselves in the chat, but it's helpful for us to know who's in the room. So let's have a look. Okay, we'll come back to that because there's this problem with the poll there. But
would you like me to launch the poll?
Yeah, I don't see the first one there. Sorry.
Is it are you a COP member?
No.
Okay, I'll fix it. Apologies. Maybe you can continue with the next.
Yeah, okay. We'll come back to that. So we'll do that poll after Hazel speaks. So let me introduce our first speaker. Hazel is an economist and a senior research coordinator at IFPRI, the International Food Policy Research Institute. She co-leads the methods module for the CGIAR Gender Platform, is a co-PI for phase 2 of the Gender, Agriculture and Assets program. And for 8 years, she led the Gender, Equity and Empowerment Unit at the CGIAR research program on agriculture for nutrition and health. Hazel was part of the team that brought us the WEA, the Women's Empowerment in Agriculture Index, and also the Reach, Benefit, Empower, Transform framework. So we couldn't think of anyone better to talk us through what the framework is and what it means. Handing over to you, Hazel.
Great. Thank you so much for that introduction, Joanna, and I'm very pleased to be here. So today I'll be talking about the Reach, Benefit, Empower, Transform framework, as you heard, which is really useful for getting projects and programs on track for achieving their goals related to gender. So you can go to the next slide, please. So what it really does, so the first thing it can help us do is to help us take a step back and clarify what exactly does it mean when we say we are addressing gender issues in projects and programs. And so the reality here is that there is a range of possible goals that a project or organization can aspire to when it comes to gender. And what we found in our work is that the conflation of these different goals, it's what's resulting in sort of lack of clarity in what the activities need to what activities need to happen, and therefore and what indicators make sense to measure progress. So we discovered through developing the project level women's empowerment in agriculture index that we can actually categorize these goals into 4 categories. So reach, benefit, empower, and transform. And what this means is that depending on what your goal is, there are different strategies and activities that need to happen to achieve these aims. And therefore, the indicators that you need to monitor progress will also vary. So let's start with reach. So if your goal is to reach women, which is, I think, a very common goal for agricultural development projects, that means including women in program activities. So you want to ensure that women have the same opportunity to participate in program activities as men do. And this could mean minimizing any barriers to participation that women specifically face, for example, related to how program information is shared, timing and location of trainings, and so on. Now, you also have interventions and projects that aim to benefit women. So these are programs that aim to benefit, women's well-being in some way. So this could be around food security, their own income, or their health, or any other sort of types of benefits. And here, what's required is not simply reaching women. So there's a step further than just reaching women. The intervention or program itself needs to be designed and implemented in a way that takes women's needs, preferences, and constraints into account. So the intervention itself needs to be valued by the women themselves, and the benefits need to directly accrue to the women. So, for example, if you have a training on a specific crop or economic activity that they're not interested in, that training is, in their mind, a waste of time and doesn't add value. So if it's not something they value, then they can, even if they attend the training, so you could have a reach sort of activity that looks like how many people attend the training, it may not necessarily lead to benefit if it's not something that the women want or need. So the next type of program or program goal is around empowerment. So these are interventions that facilitate women's empowerment, and we use empowering women sort of as shorthand, but really we want to recognize that women empower themselves, and our programs and projects are there to facilitate that process of women empowering themselves. So these are interventions that influence women's ability to make strategic decisions in their lives and put those choices into action. So this is going beyond reaching and benefiting women, although reach and benefit are necessary preconditions for empowerment, but you need other things, right? So these interventions can include activities that aim to increase women's decision-making roles and agency around various domains. These are activities that involve not only women, but also men, and is able to shift gender norms and attitudes among your beneficiaries or among your participants. And then finally, you have interventions or programs or projects that aim at transformation, which is really focusing on changing systems in which the women are embedded. So not just the participants themselves, but the broader structures, right, where women are embedded. So these would go simply beyond empowering women participants and really change attitudes and norms in the larger community. So the key distinction between empower and transform here is that we're going beyond empowering the individual women or the individual beneficiaries. And these are interventions that it can include activities that changes gender norms at the household, community, and societal levels, those that address structural and institutional barriers and mobilizes the power of the collective. And again, men, of course, must be involved in these transformations, right? So both in the empower and in the transform sort of goals, you do need to make sure that your activities do involve men. And so what this overall framework, as you can see, shows is that simply including women in project activities that does not necessarily benefit them. And even when women benefit, they are not necessarily empowered. And then finally, empowering individuals does not necessarily mean that the system has changed. And so clarifying, distinguishing between the goals of reach, benefit, empower, and transform is really important in our work, because each of these goals, as we've shown, will require a different set of strategies and activities, and therefore a different set of indicators for tracking progress. So that's sort of the general idea around the platform. So if you go to the next slide, please. Let's try to apply this in the context of a livestock vaccine intervention. So how would you then apply this framework to a specific project for livestock vaccine? So here's the example, right? So if your goal is to reach, so like think of this project, I know many of you may be familiar with this type of intervention. So, a goal you can have that focuses on reach could be around making women aware of the benefits of vaccinating livestock. So if that's your goal, then the kind of strategies you might use is targeting women for the extension around this particular practice or technology. You may want to provide transportation, conductor training during convenient times of the day to make sure that women can participate. And then in terms of the indicators you would monitor to make sure that you're reaching your goal, you're measuring your goal to reach women, is you could look at the proportion of women who are attending your training, who are receiving the advice on your livestock health practices. So that's reach, right? Now, if your goal is to benefit, one example could be around reducing livestock mortality and increasing the income from the sale of livestock products. That could be your specific goal that you want for this project. How would you do that? So some strategies could be, using a vaccination payment strategy that works for women. And maybe some of you around here have in mind specific examples of what kinds of payment strategies might work and might not work for women. We want to, as we mentioned earlier, consider preferences in the type of livestock owned or cared for by the women themselves, right? So, what type of livestock, for example. And then finally, in terms of indicators, you will want to measure sex disaggregated data for livestock ownership, livestock income, time use, vaccine uptake, and so on. And it's really important to mention that the data here needs to be sex disaggregated, because as we mentioned, we want to understand how much of the benefits accrue to the women themselves. So it's important to measure this at the individual level so we can compare the benefits that accrue to women and the benefits that accrue to men and see to what extent we are in fact benefiting women. Okay. If the goal is to transform, then as we know, this is just going beyond making sure they're aware of the benefits of livestock vaccination. It's going beyond, the benefits of reduced mortality of livestock and increasing income from the sale of those livestock products. But we also want to increase women's agency and decisions around, for example, the use of livestock income. And in that case, the kinds of strategies we might want to use include activities that aim to increase women's bargaining power within the household. So for example, by increasing women's ownership of livestock assets and increasing their control over the income generated over those livestock activities. Training and developing work opportunities for women vaccinators, right, could be another strategy. And how would you then measure that progress or impact around around this goal? You could track decision-making power around various domains like marketing and sales, production, income, sort of consumption of eggs, milk, and meat, for example. You could look at freedom to travel to markets to sell livestock, whether you see reductions in time burden. So all of these can help track progress on whether women's agency around these critical decisions on livestock are expanding. And then finally, in transform, the goal is to change gender norms and structural conditions at the community and societal level. So it's a step beyond empower, right? So this is a really more ambitious goal. And in this case, to be able to achieve that, you need more than just the strategies you would use in an Empower program, right? Or intervention. You will also need, figure out a way to remove policy structural barriers that limit women's participation in the livestock value chain at different levels, and demonstrate that local women can be trained professionals in the livestock value chain, for example. These are not meant to be exhaustive, but just to give you some ideas on what kinds of strategies would make sense. And then finally, changes in attitudes and you would measure it. So to go to the indicators, changes in attitudes and norms, in the larger community about women's ability to manage livestock, changes in gender roles, and the extent to which those barriers have been removed. These are some of the things that you want to track to be able to look at transform. And if you click one time, Joanna, these are these indicators that are in this box. These are some of the things that can be measured, for example, in a tool like the Women's Empowerment in Agriculture Index, or the different versions of it like the ProWEA, or the Women's Empowerment in Livestock Index, which I hope many of you are familiar with. So some of these indicators are embedded there and can be measured in that way. Next slide. Right, okay. So so that's the main framework, right? Now I wanted to say a little bit more about the benefit category, right? Because I think once we're clear about the different goals, and we also realize that not every program needs to aim to empower or needs to aim to transform, or may not make sense to do that. And so focusing on the benefit category, just to explain a little bit the value of collecting sex disaggregated data. So I wanted to show you here a little bit of the thinking around how we think about how households make decisions, right? So in economics, there are sort of two general models that we like to use to describe household decision making. So one is called the unitary model, which is like everybody acts in the same way, either because you have like a benevolent dictator, so only one person makes decisions for everybody, and then everybody just follows, or everybody has the same preference, in which case it doesn't matter who you ask because they all want the same thing. And then in contrast, you can have a bargaining model where actually you recognize different household members may have different preferences, different constraints, different needs. And then depending on how much power each decision maker has, then they negotiate. And that's how you come up with a decision or an allocation within the household. Now, the reality, if you go to the next slide, is that it's really more complicated than that. We know that the unitary model has been firmly rejected by the evidence. So we know that that's not how households work, right? I mean, you could just look at your own household. I don't know that anybody can find that as, in their own household, that people have the same preferences all the time. But it's also not true that the bargaining model reflects everything. So anyway, the point here is that when you measure benefits at the household level, you are making that assumption that the household is acting as one, and that all the benefits to the program flow equally, right, across all the household members. They benefit equally. And if you go to the next slide, basically what we want to show is that there are sort of different levels of analysis that we can do, but if we want to do a gender analysis, we really need to go beyond simply comparing household types. So for example, male-headed versus female-headed. This is not a full gender analysis because you also have women living in male-headed households, and you may have men living in female-headed households, right? So it tells you about the household. It doesn't really tell you about the individuals. And when we're trying to say something about gender, we're really interested in the individual. So if you click through the next slide, we see that when we collect sex disaggregated data, we're really getting at the individual level information, the income that they themselves earn, their own health status, their own sort of economic conditions, and so on. So next. So this is just to show that the different activities or livelihoods in the in a particular household could be mixed, right? Some activities, households in developing countries and low income settings where we typically work have very diverse livelihoods, and they may be doing many different things. Some of them could be male managed, some of them could be female managed, and some could be jointly managed. And that's what we miss when we only look at the household level. So on to the next slide. Right. I'm so glad that there's somebody else speaking on qualitative research, because you'll hear more there. But just to highlight here that whenever we try to measure impact around the gender outcomes that we care about, especially around empowerment, it's really valuable to use mixed methods, meaning both quantitative and qualitative methodologies. So when I describe the indicators, in that matrix kind of first slide on the framework, a lot of these indicators are kind of numeric indicators, right? So quantitative indicators. But I just want to mention that those need to be supported by qualitative methods that can also answer the why and the how. So by using both together, we're able to answer broader questions. We can bring in different perspectives, triangulate, address some blind spots. So maybe one method can address some questions and other methods can address other questions. For ProWea specifically, we've been able to really use the qualitative research to help us understand the conditions of poverty and women's empowerment. It helped us sort of refine the salient, what goes into the project level index to understand which domains make sense in the local context, and most especially unravel the links between the project interventions and the empowerment outcomes. So it really helps you unpack not just what impact happened, but why and how you can scale that up and replicate that. So just to mention also that a ProWea has both quantitative and qualitative protocols that are available to use. Next slide. So I wanted to kind of end, next slide, please. I wanted to end with some lessons that we learned from the GAP2 portfolio. So the GAP2 project, Gender, Agriculture, and Assets project, is working with a portfolio of, previous slide, please. The portfolio of 13 agricultural development projects that helped us develop the ProWea tools. And they're using this to measure their empowerment impact. And what we discovered from their experience is that the successful projects are intentional, right? Meaning they have an explicit goal, right, that they want to achieve, that to empower women. They have actual strategies and implementation of these strategies. They try to address norms, they work through groups, and then they involve men and other influential household and community members as part of that solution. And so just to mention here that, we tend to observe better impacts from projects with explicit gender transformative strategies. But even successful projects have to watch out for workload. So there's, we're seeing this trade-off between workload and other dimensions of empowerment. And so even when the women themselves say this was worth it, it improved other aspects of their lives, the workload tends to increase for many of these programs. And I just wanted to end with some resources for you. So we do have, next slide, there's a video on YouTube that you can take a look at. It's 2 minutes, very short, and you can share that with your colleagues to introduce them to the idea of the framework. Here, there's like an embedded link there. And then in the final slide are just some links to the paper on Reach, Benefit, Empower, as well as some distance learning courses that are available on the WEA resource page. So let me end there. Thank you so much. I hope that wasn't too fast. I hope I wasn't talking too fast.
I think that was great. Thank you very much, Hazel. I think that was a really useful outline of the framework. So it really helps us kind of situate where projects are. So we've got a few minutes. If anyone would like to ask Hazel a question, you can either put it into the chat or you can unmute and ask her in person. And I don't think I've seen anything in the chat as yet, but if anyone wants to put their hand up. Annie, do you have any? Oh, Simon.
Yeah, hi. So there's some very interesting things in there, but one point that I find quite interesting that we thought about a little bit, but I've got no insight in how to do this, was how to engage men to support getting that positive outcome. So I wonder if you could give some insight into that.
Sure. So some examples from our project. I mean, there's one project that's part of GAP 2 called Angel, the Agriculture, Nutrition, Gender Linkages project that's in Bangladesh. And one of the things that they did was to do these household I'm forgetting the actual name, but they're using an HKI nurturing connections curriculum where they involve the couple and so the couple goes through some training that that covers gender attitudes, it covers, I think, communication, it covers a whole bunch of other topics. And I think what we've heard around that is that the couple themselves have found that very useful because it was a way for them to start talking about things. So even, regardless of content, the fact that the couple sort of came together and started talking about issues and decisions within the household actually turned out to be, very welcome and helpful in their view. So that's one example, right? So there could be this sort of community conversations or, couple trainings and so on. So that's one way. Yeah, so maybe I can stop there if in case
Does
there are
that
other
work in
questions.
like a group context or only in an individual couple context then?
So I have to double check. My sense is that they are trained as a group, but I need to follow up on that. So basically they come to a training as couples together in a community. So that is my understanding. There are also other kinds of like similar interventions that involve the couple, where the couple themselves do activities together, they individually and by themselves. I think Beth has her hand up. Maybe she has more examples for you.
I think it's a great question because it's something that every project has to deal with once they decide that gender is there are gendered barriers and that they need solving. Working with male veterinarians is often a really good entry point because they don't necessarily see a problem with only working with men initially, and they're generally very well respected in their communities. And we may hear a little bit more of that from the foot and mouth disease program in a little bit. So that's been a very helpful entry point. In order to accommodate or to create training opportunities where both senior male and senior female from the household come, there often has to be other accommodations. Like a requirement for training may be that there has to be a male and a female from each household, because we know from the evidence that information given to the men does not trickle down to the women. And we know this is a problem because many tasks are performed by the women. So if that's simply a requirement and there are accommodations such as childcare there, and all the men have to do it together. It's not just one man who will feel somehow isolated or mocked. I think you can get very good response.
Thank you, Beth. Thank you, Hazel, for joining us today, and thank you for speaking. We really appreciated your time. And so I am going to move us on in the interest of time to the next part. I actually want to do that poll to give us an idea of who is here. So you should all be able to see the poll question there. We've got a couple of people answering already. This just gives us an idea, because LD4D is such a big network. It helps some of our presenters to understand who they're talking to when they're presenting. So we've had 70% of people. And I think I'm going to last chance for anyone to participate. Okay, so oops, let's just end the poll there. We can see that we've got mostly academia, but also some people from government and business. Okay. Excellent. I'm just going to share my screen again. And before we move on to the next speaker, I just wanted to talk a little bit about the COP that we have and how we got here. Because SEBI Livestock, the secretariat of both LD4D and the COP, became gender intentional only in January last year at our reinvestment by the foundation. And in working through the things that SEBI could do to monitor and measure gender outcomes, we spoke to many of the foundation's livestock partners, including with the veterinary paraprofessional project that we're about to hear from. And we found that people working in gender had kind of all levels experience. So we had people that are just starting out and people who are experts. But what we found was the common factor was that they're often working in isolation or in a very small team, and they wanted a forum to be able to discuss their experiences. And this was strongly echoed in February this year at the Foundation's Livestock Partner Convening, which led to our launch of the Gender and Livestock Data COP in March this year. So just another poll. Let's see who here is a member of the COP. So hopefully you can see on your screen that we've got just a question asking whether you're already a member of the COP, whether you're not a member, or whether you're considering joining. And I'm just going to give everyone 10 more seconds. It's looking very even at the moment. Okay, let's call it there. And we've got 7 people who are not in the COP, 6 that are, and 5 that are not yet. Okay, thanks for that. So for those who have not been a part of the COP, so far this year, since March, we've had 4 meetings with COP members, and we pick topics that the COP members are interested in, and we talk about them for an hour, generally once a month. We've had, including this session, 2 meetings with the wider LD4D network. We currently have 129 COP members, and our aim really is to create a forum where people working in gender can share their experiences, both their problems and assumptions that they're trying to deal with, but also solutions. We also disseminate information about events or opportunities, or information from members who are trying to reach out for particular data or for contacts. So please get in touch with us, Fiona or myself, if you'd like to join. Okay, so let's just move on to our second speaker. Jenny Maud from EUFMD is a veterinarian with postgraduate training in veterinary education. She has worked with the European Commission for the Control of Foot and Mouth Disease and the Food and Agriculture Organization of the United Nations since 2013 in a variety of roles relating to training and capacity development in animal health, including leading the development of online training programs for global audiences of veterinarians. She's now working across 2 projects with FAO, including coordinating the development of training under the program Sustainable Business in Animal Health Service Provision through training for veterinary paraprofessionals. And this is the project that she'll talk about today. So handing over to you, Jenny. Can you like to share your screen? Thank you. Okay, that's coming up.
There we go. Hopefully it will. There we go.
Perfect.
Thank you very much, Johanna. And I think before I start, just to introduce another person, because this presentation was authored by a colleague of mine, Emma Alegi, who unfortunately at a short notice couldn't be with us today. So I'm very much giving this on her behalf. And the lovely presentation you see here is her wonderful work and not mine. So I'd like to thank her at this stage. So I'm going to talk a bit today, just to give you an overview very briefly of our project as a whole, but the gender focus within that. And then really today I'm going to be talking about the needs assessment process that we've taken to guide the development of our training programme, which is now underway. Some findings for that, of course, related predominantly to gender, and then how that's then guided us and how we've used what we found in the development of our training programme in using some gender sensitive approaches. So we have a 3-year project with a very long name, as Joanna just told you, that focuses in 3 countries, Nigeria, South Africa and Uganda. The overall aim of our project is, or the objective of our project is, to build the sustainability of smallholder farming systems, improve the productivity of smallholder farming systems in these countries. But the tool to do that is through development of continuing professional development training for veterinary paraprofessionals. For those of you who aren't so aware of veterinary paraprofessionals, these are usually colleagues with between 1 and 3 years of training, who are responsible for a lot of the delivery of primary animal healthcare services in the countries where we're working, or predominantly, I suppose, in Nigeria and South Africa, that's the case. In Nigeria and Uganda, that's the case. South Africa is a slightly different model. And our tool is particularly focusing, or our aim is particularly to develop training for the veterinary paraprofessionals working in the private sector, and to train them in a combination of improved business skills, but linked very strongly to provision of preventive livestock healthcare services. Traditionally, these veterinary paraprofessionals are involved in coming along when there's a problem, when animals are sick. We'd like them to, of course, continue to do that, but also to be able to better advise farmers on how they can prevent disease and make their livestock more productive. When considering gender within that, we have to consider that in this profession, women are very much a minority in all 3 countries, but particularly in Nigeria and Uganda. And there are barriers for women in terms of accessing training and upscaling their businesses. And our hypothesis, although I'll discuss that a bit today, is that female veterinary paraprofessionals may well be a particularly important channel for reaching women livestock keepers. So our aim of our project is to adopt a gender-sensitive training model to improve veterinary paraprofessional services and make them more inclusive. And that meant when we set out at the beginning of the project, we needed to take a gender-responsive approach to needs assessment that would help us to maximise female training participation. So we set out on our needs assessment with 3 main research questions linked together. So how the veterinary paraprofessionals would learn best, what the priority competencies were that should be built through the training, and what the current and future business environments for these veterinary paraprofessionals working in the private sector would be. The needs assessment took 2 main approaches, a qualitative participatory rural appraisal, and then a quantitative telephone survey. The project has been designed to include a significant amount of online learning. This was the reason why we chose a telephone survey. We didn't want to bias ourselves by using an online survey to ask people about their access to online training. And we validated our findings with a further visit to the communities involved in the participatory rural appraisal. So we hoped that this mixed method approach would be beneficial and help us to cross-check our findings, but crucially, we considered gender across all of this. So there were gender questions embedded as sub-questions within each of these areas that I'm talking about today. And we've got results now from all 3 countries. It's not possible in the short time we have available to walk you through all the different results from all 3 countries. So we're just going to give you a snapshot of some of the things that we found and how valuable it was to consider gender as part of both of the qualitative and the quantitative work that we did. So one thing we wanted to know was about the access of women and men to technology and to the internet. So as part of our telephone survey, we asked about the ownership of computers, the ownership of smartphones, and access to the internet. And you can see here in blue are the responses of women, and in orange the responses of men. And we interviewed 150 veterinary paraprofessionals by telephone in each country. of course, due to the makeup of this profession, there were fewer women interviewed than men in all three countries. And you can see that it's interesting, there are some significant gender gaps. So the biggest gender gaps are really in, and these are the things highlighted in these yellow bubbles. So there were really significant gender gaps in Nigeria in particular, particularly in relation to access to computers and access to the internet, where women are significantly less likely to have access to those resources. But this was also reflected to a slightly lesser extent in Uganda. Interestingly, in our telephone survey, smartphone ownership was very similar between both genders. And it's interesting then to compare to the outcomes of our participatory rural appraisal. So we conducted these in all three countries with different focus group approaches. We had some female-only focus groups, some mixed gender focus groups of farmers, focus groups of veterinary paraprofessionals, some key informant interviews, and various participatory approaches used within this. Women in particular, and here I'm talking particularly about Uganda, expressed a preference for in-person training, but this was largely because they were very unfamiliar with online training, or certainly that was how they commented. Interestingly, in the participatory rural appraisal, women said they had a significantly lower access to both smartphones, internet and computers compared to the findings of our telephone survey. And this was, I think, something I'll come back to in terms of the value of using both approaches and trying to learn from each one and the drawbacks of each approach as well. I think it wouldn't be a great surprise to learn that many women had higher care and household responsibilities, and these often clashed with fulfillment of a professional role as a veterinary paraprofessional. And they also had challenges in terms of moving around. Veterinary paraprofessionals tend to travel on motorbikes, and this was in some cases seen either as unsafe or culturally inappropriate, or purely difficult because motorbikes were very heavy. And in Uganda, some female veterinary paraprofessionals commented that they didn't have overall decision-making power on whether they would be able in the household to choose to undertake this training. I think this issue of familiarity and access to devices was quite interesting, and one of the sort of challenges we have. So this female veterinary paraprofessional in Uganda says that online training would be the best for me because she would be able to work that around her other challenges at home, but she doesn't own a phone, so she couldn't therefore access it. So it shows some of the challenges that we're facing with this approach. Another interesting thing, and I think one of the values that we found in taking this gender disaggregated data from all of our studies, was when we asked, again in the telephone survey, what the priority topics were for training. And on the right-hand side of this screen, you can see the results which are not gender disaggregated. So here, of course, the larger bar represents the topics that were expressed as a highest priority. Of course, in this, we can then see that there are these three topics at the bottom, which are clearly very high priority. When we look on the left, and again, we have the men in an orange bar and the women in a blue bar, you see that actually the women's priorities for top three topics are quite different. So the women would like business skills training, communication training, and training in animal production economics, which actually echoed the top three of the men. But it showed us that had we not done this, we would have missed the fact that women had a different preference to men in terms of training topics, and perhaps particularly requested this training on business skills. You'll see also that women in the telephone survey were far more interested in training on artificial insemination than men, and also significantly more interested in diagnosis and investigation than men. We did the same thing then in the participatory rural appraisal, and these results didn't always concur with the telephone survey. So there were differences, for example, in preference for training on artificial insemination, and in reverse of what we found in the telephone survey. There were some topics for training that came up in the participatory rural appraisal, which we didn't find in the telephone survey, such as training on nutrition. And there were some which were similar. So in both surveys, we found that women were particularly keen on training on communication skills. And there's probably several reasons for this. So very different methodologies for data collection. We're of course in particular areas for the participatory rural appraisal where the type of livestock systems may necessitate different types of training. And of course, issues of sample size for the telephone survey versus the participatory approaches. Some of the key gender insights that we found, and here's sort of just really taking our impressions across all 3 countries. We had frequently mentioned, unfortunately, issues of sexual harassment from farmers for women veterinary paraprofessionals. In Uganda, it was particularly interesting in that there was a lot of mistrust of female veterinary paraprofessionals by both male and female farmers. And in fact, female farmers particularly mistrusted female veterinary paraprofessionals because they were worried they may run away with their husbands. In some countries, there were less mentorship opportunities for women compared to men, with the exception of South Africa. Women veterinary paraprofessionals often expressed that they lacked confidence, that cost was more of a concern for women than men, and particularly travel costs. Women were generally paid less for their services in comparison to male veterinary paraprofessionals. And then we had some particular challenges in some countries. For example, in South Africa, it's not culturally appropriate for women to enter the kraals where the animals are kept. The animals have to be brought out to them to examine. And then a very common challenge expressed was that female veterinary paraprofessionals were less able to physically work with large ruminants when compared to men. So how have we used this to adapt our training program? I think the first philosophy we've taken, and bearing in mind that the end target of all our training are the smallholder farmers rather than the veterinary paraprofessionals themselves, we see that all veterinary paraprofessionals, whether men or women, need training on gender sensitive approaches. And we'd like really to build this kind of team approach to gender approaches within the groups of veterinary paraprofessionals that we'll work with. We saw that a lot of these issues of trust really focused on communication skills. And in fact, this goes across genders, but improving communication skills and building trust to get past suspicions such as the female veterinary paraprofessional will run away with the husband benefits both genders. And I think within that, including confidence building, empowerment, managing difficult situations at work, and to some extent, this same communication training may help us address the issues of sexual harassment. We do see a particular need to empower women veterinary paraprofessionals and have the idea of setting up a mentorship network, including a variety of role models who are female, and that's particularly recognising the far fewer numbers of female veterinary paraprofessionals compared to males. And we have tried to include a minimum quota for female participation in our training programmes. So the training that we'll develop will be a blended model, including practical sessions where veterinary paraprofessionals will meet together and work to apply theory that may be taught also online. And we've increased the amount of practical sessions based on the findings of the needs assessment and challenges related to internet access. We will take various steps to support internet access through provisions of data or equipped study hubs, and all the training will need to be by smartphone because, as you saw, relatively few paraprofessionals have access to a computer. We will make the training flexible so that it can fit around family commitments, and we'll provide childcare facilities for female veterinary paraprofessionals attending training with young children. We'd really like to take a family approach, particularly in Uganda. There was this report that sometimes husbands may be unhappy with female veterinary paraprofessionals going away for training, and we'd like to include the whole family from the beginning of the training and send support packages to the husbands or wives and families of those who will take our training. We have integrated animal handling as a course, as a main course topic, and actually this has been very well supported also through lenses of animal welfare and just safety of veterinary professionals, whatever gender, and providing training on animal handling and building suitable facilities such that men or women are able to handle large livestock safely while going about their work. So just some of the conclusions for this talk. So I think we really found the mixed methods approach very complementary, also to find some of the biases and some of the challenges in the data coming from either of the two approaches, and to be able to compare the two. We really enjoyed the value of participatory approaches in preventing this training becoming too top-down. Having the gender analysis across everything has really allowed us to integrate gender in all sorts of different aspects of the training programme. And we've really learned that we need to consider gender from the beginning of the project, and not only in the target audience for our training, the veterinary paraprofessionals, but also what's happening on the farms that these veterinary paraprofessionals are serving. Finally, just a little note, because I was asked, when I was asked to give this presentation, to have a little note on how did we do this and how much did it cost. And here it's actually a benefit that Emma is unfortunately not with you today, because I can give her all the credit for this. We have been very lucky to have Emma join us initially on an internship and now on a permanent basis as our gender specialist. She's a full-time member of our team and works as the gender specialist, but also across a whole lot of other areas to do with implementation of the project. And this means we have somebody involved in every part of the project who may sometimes sit there quietly in a meeting, but then pops her hand up and says, have you thought about the gender implications of this? So I think having somebody like this with that role on the team has been very valuable. How much did this cost? Well, I would say that I don't think it's an additional budget. This is a role we had foreseen. Having it as a gender specialist means that probably Emma spends about half her time working on gender related issues. And I just also included this picture here. So this is Emma working with one of the trainers in Uganda at a workshop a few weeks ago, where we collaboratively developed our training, and hopefully you can see how we're managing to bring the women focus in at every step in the programme. And as I said, this is really not my work, but the work of a whole team in EUFMD and in the 3 countries where we're working. So thank you very much.
Thank you very much, Jenny. It's really great to see an example of how working with a gender specialist so closely has really allowed you to kind of pinpoint those things that are really important to women, and then tailor your project activities around that. And it was great at the end to hear sort of, you know, what resources does it take to do that. Okay, so I think we have time for 1 or 2 questions. So Annie, I think I saw a couple in the chat. Do you want to unmute and ask 1 or 2 to Jenny, please?
There were a couple. One from, in fact, quite a few. It's been quite lively. One question from Isabel about the bias in conducting phone surveys instead of face-to-face and the accuracy of responses. And I think to some extent you addressed that, Jenny, but perhaps you could go into it a little bit further. And Alessandra has put an additional related comment in about the extent to which women might be interested in AI because, or a phone call, because they might be able to say things that they won't feel comfortable saying face to face. So I wonder if you could take a moment to speak to those issues.
Definitely. I think we chose the phone survey methodology because of this issue, that we didn't want to introduce this huge and very obvious bias of running an online survey. Still does bring in a number of other biases. So, for example, a selection bias in that we relied on lists of phone numbers from various professional organisations, and I think you can argue whether there's a likelihood that more male or females are likely to be a member of those. Certainly in Uganda, for example, the professional membership was slightly more urban based than the more rural areas that we consulted in the participatory rural appraisal. I think I don't know the answer to this. You could hypothesize that women are slightly more able to speak freely on the phone than they might be face to face. But you could go the other way and say, if I had a stranger phone me up and ask me questions, I might not be willing to talk to them. Whereas if I was talking to somebody in a more friendly way, then I'd tell them more. So I think some of this is very difficult to say. I think the other thing I suppose we would learn from this was that, of course, we relied on enumerators to conduct these phone surveys, and that does introduce some inaccuracy and some challenges there. Unfortunately, we would have loved to phone 150 VPPs in each country ourselves, but that would have taken quite a lot of time. And I think that's another area of inaccuracy to consider.
Thank you. We've had many questions from Remco de Waal, and so I think you two might end up having a separate conversation later. But one which I thought was particularly interesting and probably applies to any presenter is, do you offer an overview per country on how to empower women? In other words, is there anywhere, and so this is perhaps something that you might answer, Jenny, and maybe Beth or Alessandra could come in afterwards. Is there anywhere any guidelines on how empowering women varies country by country?
I think others will comment more than I do on what else is available, and I'm very much a novice in this field, as Emma is not able to join us today. I think the very interesting thing we found was that there was broad similarities between countries in many things, but actually really huge differences. And an example is the sort of the mistrust we found of female veterinary paraprofessionals in Uganda, for example. So I think certainly we learned that yes, there are some broad similarities, but I think you do need to consider each country very differently. I'm actually really looking for the first training will start in November in Uganda, and I'm really looking forward to this idea of this female veterinary paraprofessional network that we'll establish, because I think getting in touch with these colleagues in a much more in-depth way over a period of time and working with them on what these challenges are will sometimes allow us to separate from what we sort of assume are problems, or people assume are problems, to what really is. And the animal handling one is an example of that. When you speak to anybody in Uganda about female veterinary paraprofessionals, they'll say, well, they can't handle the cattle as well as the males can, but actually maybe that's something with discussion we can find the nuances in that and what those problems are and how to overcome them, and that will be quite interesting going forward.
Good, thank you. I think we could run with this topic. I've just been reminded by Joe that there is a time limit. So thank you very much indeed, Jenny.
Thank you, Jenny. Really, yeah, fantastic presentation there. I really love to see these examples of people, applying this and running with it. So we've heard from our last two speakers about how helpful it is to mix qualitative and quantitative methods. And I'm a little bit curious as to how many people in the audience today have used or have collected qualitative data, or have used it in some way, shape or form. So I've got the last poll of the day, I promise. And it's looking pretty good. So far, everyone has collected and has engaged with qualitative data. Oh, we've got some people. Okay, we're getting a bit of a mix. And I'm going to give everyone 10 more seconds to answer the poll. And let's have a look at these results. Okay, so we've got 2/3 of people that have collected and engaged with qualitative data, and then a couple of people that have never collected or have engaged with it in varying amounts. Okay, great. That just gives us an idea of where people are. So I'm going to hand over to Fiona, who's going to introduce our last speaker for today. Thanks, Fiona.
Thanks, Johanna. So yeah, it's a real pleasure for me to introduce our next speaker, Katie Adam. Katie and I studied together at the Royal Dick School of Veterinary Studies in Edinburgh. And Katie's a research fellow at the University of Edinburgh now and describes herself as an interdisciplinary animal health researcher with a background in clinical veterinary practice, veterinary epidemiology, and social science. Her research interests lie in the human factors that influence animal health. She uses both quantitative and qualitative methods in her research. So really lovely to have you join us today, and I'll hand over to you now, Katie.
Thank you very much, Fiona. Can everybody see my screen? Apologies, I've lost you all.
Yes,
Yeah.
Give me a shout if there's any issues. That's lovely. Well, thank you very much for the introduction, and I'm pleased to see some fantastic examples. They're really interesting presentations about sort of some examples of qualitative research in action. So I believe that it looks like quite a few people have fairly extensive experience of conducting qualitative research. So you may disagree with some of my points, but for those who are perhaps a little bit newer to the idea of qualitative methods, hopefully this is just a bit of an overview, an introduction, and a starting point for perhaps if you want to give this a go yourself. So a little bit about my background, how I came to be here, how I came to work in qualitative research, which I'll be honest was not at all what I had in mind when I was a veterinary student quite a few years ago now. But I trained as a vet, I worked in clinical practice, and then I moved into veterinary epidemiology and was involved in field studies mostly in the north of Scotland. So I was travelling around and gathering biological samples, conducting surveys, and a lot of it was talking to farmers. I was having these really interesting conversations with the farmers, with the people that I was working with, and yet it wasn't part of the project. It wasn't really being captured in any way, and I thought it's really missing. We're missing so much useful information here. So I went to do a PhD in more of a sort of social area, and that's where I've worked for a number of years now. My primary research interest really is about the role of people in infectious disease control, particularly in animal diseases, but also a kind of One Health, human health approach. I hold my hands up. I absolutely admit I'm not a gender specialist, so I defer to the far superior knowledge of those in the room with much more detailed knowledge of this, but it is something that I see coming up in my research, and it's been really interesting to hear more from the other presentations today. Some of the aims of my presentation today really are to provide a bit of an introduction to qualitative research, what it is and why it might be useful in some of your work, and provide a little bit of an overview in how to get started. Some of this is just introducing a bit of the terminology. As with quantitative research, there are a lot of terms that crop up and might be unfamiliar, and I think even just being aware of those can be really helpful. And I hope will give you a kind of starting point if you want to attempt some qualitative research or to include some qualitative methods in your current work. So what's qualitative research about? Why is it different? And really what it's good for is understanding these sort of socially constructed parts of our reality. However much we like to think that we are logical, rational, objective beings, that's not really the way that humans work. We are influenced individually by our experiences, our beliefs, our attitudes, and externally as well by kind of cultural and social norms. And qualitative research can give you that insight into how people see the world and how that influences what they do. And from my own experience, I think a lot of this is about unlearning your training as a clinician or as a scientist. It's a very different approach to research, a very different way of thinking about things, thinking about the world. From a more scientific background, you're trained really to step away from that kind of emotional and intuitive part of the world, even though it very much influences what we do. So what are quantitative and qualitative data? In the simplest form, it's quantitative if your data are numbers, and it's qualitative if your data are not numbers. Now, generally, and in terms of my presentation today, I'm thinking about qualitative data as words, because generally as humans, that is how we understand and interpret and describe and make sense of the world. And really, it's about using the right method. It's having this toolbox and using the right method to answer the question. Qualitative research goes deeper into those kind of how and why questions, more of those open questions. The research process really is not that different from a quantitative study in many ways. It's about having a clearly defined research question, knowing what it is that you want to ask and why, designing the study carefully, making sure that what you're going to do will answer your research question, then going on, doing it, collecting the research data, and finally coming back to analyse and present your results. Now, I'm going to talk about that a little bit, but I'll focus mainly on that point up to sort of collection of data, just for the sake of time. So what kind of data might you want to collect? Generally, I think that probably verbal data collection is more common, and personally, I think is more interesting. You get that kind of interaction with your participants, you get much richer data this way. And you can conduct interviews either individually or with groups as focus group. And it really depends on the question that you're asking. Is it the kind of topic that perhaps is something that people might be a bit sensitive about discussing in a group, in which case you might want to consider conducting individual interviews either in person or face-to-face or via telephone, as described there by Jenny. Or focus groups can give you a very different energy. You get all these sort of different points of view and the interaction between your participants, which can be really beneficial. So it's really about using the right approach for your study. You can use written data collection as well, and free text survey responses can be really interesting. Those kind of boxes at the end of a survey for a bit more information. And you can get some really useful information in this way, but you do lose that, as I say, that kind of richness and a more interactive approach. Something else that I have used is sort of written materials and written participation during focus group discussions. Now, this can be a really nice way to capture what's been discussed and to make sure that everybody has an opportunity to contribute, even if they're perhaps a little bit quieter. But I would say use this very carefully. In some circumstances, it just won't be appropriate. You need to be confident that all of your participants have sufficient literacy levels. For instance, it's not something I would tend to do with farmers in Scotland. We know that there's a very high prevalence of learning disabilities and that not everyone will be comfortable with written methods. So for that reason, I might steer away from it. Study design then is the other thing to think about. So what are the questions that you're going to ask? Coming into your interview, whether that's with an individual or a group with a schedule of what you're going to discuss is really important. And probably the way that I would recommend going about this, it's not an interrogation, it's not a list of questions to ask and to be answered, and then you move on to the next question. It's more of a topic list. It's a kind of, well, these are the things that we want to talk about. Let's make sure that all of these points are covered in the course of the interview, but it's not necessarily that we go through it in a strict order. And then developing those interview questions is really a case of starting with that central research question. So I've taken an example from some research that I've done in Scotland previously about why smallholder farmers in rural Scotland keep poultry. So we have an ongoing bird flu outbreak in Scotland at the moment. And the question really is, well, why do we have all these people with small chicken flocks? We're concerned about the impact on bigger commercial production. What do people gain from it? And so you might break that down just a little bit to zoom in on particular aspects of the question and to make it a bit more manageable in terms of doing the interview. So asking, starting with something quite general, tell me generally about your birds. Why did you decide to start keeping poultry? What was it that motivated people to get into it in the first place? And then maybe sort of pros and cons, what do they enjoy about it? What do they find difficult? This is just an example, but that case of sort of breaking down your main point of interest into something a little bit more usable in terms of conducting an interview. The next question is, who are you going to talk to? And again, there are as many ways to do this as you can possibly think of. Sampling is a case of deciding what really works for your study, which group is going to be most useful to talk to, which individuals. For instance, do you want to talk to sort of community leaders? Do you want to policymakers? Do you want a higher level view of this? Or do you want a more sort of grassroots? Do you want to talk to farmers and vets and people who are actually living the question, if we're talking about animal health studies? In terms of recruitment then, the next question is, how do you get people involved? Get this, publicising the study, getting it out there. Again, it depends where you're looking. Social media might be very helpful in some cases, in other cases it might not. Often just community networks, putting the word out there. And then your question is, who do you actually want to talk to? How do you select the individuals? What kind of mix of people is it that you want to talk to for this project? Something to consider as well is offering incentives for participation. Now, if people are incurring costs in attending, so things like travel or food, then I think it's only reasonable to cover that. And it can be nice to provide a sort of thank you gift to people for taking part, but generally I'd be a little bit careful about specifically paying people for participation. And something else that I've often found quite useful, particularly working with farmers, is linking onto other events. Is there something else happening where the people that you want to speak to will be gathering anyway? They don't have to travel specifically to speak to you. I spent a fair bit of time in Scotland chasing farmers around markets when they probably would prefer just to get on with their day. So, but it can be quite a useful way of getting hold of the people that you want. Actually doing the interview, the big phrase that comes up, I would say, is active listening. And it sounds really simple, but I find it absolutely exhausting. You've kind of got two bits of your brain working simultaneously. With half of your brain, you're listening to your participants. And it is so much about listening. That is the real focus. You want to keep the conversation moving, but it's about letting your participants talk, not hearing from you. But at the same time, the other half of your brain is thinking, right, where are we? Have we covered all of these topics? Okay, that's really interesting. I might want to know a little bit more about that. Yeah, it takes practice is what I would say. And I come back to this point about it's a conversation. It's about a sort of interaction between you and the participant to develop this discussion. And this might be a bit controversial, but my take is sometimes being a little bit stupid can be a really useful strategy when you're conducting qualitative interviews. I can think of an example from a few years ago where I was asked to look at some interview transcripts. And some of the interviews have been conducted by a professor, somebody who knew a lot about the topic under discussion. It was about cattle disease. And his interviews weren't great, I'll be honest. He talked a lot, he kind of put his opinion out there, he really attempted to kind of educate his participants, which wasn't really the goal of it. Some of the other interviews have been done by a statistician who had never done any qualitative work before, didn't really have any background in animal health, and they were absolutely fantastic because he'd listened, he'd stuck to the topics, he'd listened, he'd probed, he'd prompted, because he genuinely didn't know necessarily what the participants were saying. He would ask, well, what do you mean? Oh, what's that? I haven't come across that before. And he got some really, really valuable data as a result. The other thing is just being clear in what you're asking, an open question, so not something that can be answered with yes or no, but something that requires a kind of more detailed response from your participant. And the funneling technique of starting with a kind of more general question and then moving to more specific or perhaps more controversial topics later on once you've built up a bit of a rapport can be really helpful. And then just being aware of that issue of prompting, kind of that I want to know a little bit more about that, and just saying, oh, could you tell me a bit more about that when you come up against something that's interesting. Facilitating focus groups is quite a skill in its own as well. What I would say is, if at all possible, try to have two people, one to facilitate and one really to provide kind of support, somebody to take notes or operate the voice recorder if you're recording it, or provide any props, anything like that. It's trying to do all of that by yourself. It's possible, but it's not ideal. It's really quite tricky. And it is a skill. It's trying to draw out the people who are perhaps a little bit quiet, saying, oh, you know, we haven't heard anything from you. It'd be really nice to hear what you have to think, what you think about this, what you have to say. And then also just kind of calming down the people, because there will be people within the group who just want to be heard, and trying to, while allowing them that platform, making sure that everybody does have a chance to have their say. Again, the issue of language, I'm not going to go into this in detail. I suspect that many of the people present will have far more practical experience of this than I do, but just don't overestimate what's possible if you are not a fluent or native speaker of the language that your interviews will be conducted in. If at all possible, have professional interpretation available will make a huge difference. The big issue that comes up with qualitative research, often the sort of criticism of it, is really how valid is this data? How much is enough? How much can you tell from 12 or 15 interviews or 5 focus groups? Really, what does that tell us? You know, if you've come from more of a quantitative or epidemiological background, it seems quite counterintuitive. But the whole purpose is different. It's about depth, it's not about breadth. If you want to know what a lot of people think about something, then a survey or something like that is going to be a much more appropriate method. This is about zooming in and kind of drilling down into the details. But 2 things that we use to kind of ensure that our data are valid is this concept of data saturation. Now, there's a lot written about this. If you Google it, you'll find all sorts of information and all sorts of different definitions. My personal experience is when you start out conducting interviews, initially everything that you hear is new and exciting. And you kind of get to a point where, as you ask the question, you have a reasonable idea what your participants might be about to say. And at that point, you kind of have to question, how much am I going to gain by continuing to collect more data? And then the issue of resonance. So I think this is a great term. I really like this. But essentially, let's say you've conducted interviews with farmers in rural Tanzania about parasite control, just to pick an example of a project from a few years ago. And if you take your findings and present those to other farmers within rural Tanzania, you would hope that they kind of go, yeah, that makes sense. That reflects our experience, more or less. It's not intended to be representative in a statistical sense across the whole population, but just to capture the sort of the essence of what you're aiming to find. As I say, I'm not going to go into a huge amount of detail about data analysis. Trying to capture the entirety of quantitative data analysis in one slide would be equally impossible. But really the question is, what's your aim? How much detail do you need to achieve your goals? And one approach that can be quite nice, particularly if you're not looking for something hugely detailed or or perhaps something that you'll come back and reflect on later, is to summarise your key points and main themes with your participants at the end of the discussion. And this is quite nice as well, because you're agreeing your conclusions with the participant. You can be sure that what you're taking away reflects what they've said. Yeah, more detailed analysis. It is possible to often sort of audio record discussions and then go into a bit more detail later on, but we'll leave that for today. I hope that I've encouraged you to go out there and give some qualitative research a go, but I would just raise the issue around research ethics, that just there is a little bit of caution needed in this. I think the medical principle of first do no harm is a good one to live by. If you are conducting research and you're in any way affiliated with a university or an educational institution, they should have an ethical review process. And I think sometimes this is seen as a bit of a box ticking exercise or a bit of a barrier to actually going out and doing this, but that really shouldn't be the case. The goal of ethics committees is not to stop you doing the research, but it's about working with you and making sure that what you're doing isn't going to cause any harm to your participants. A big issue as well is informed consent, being clear with participants about the information that you're collecting, why you're doing it, what you're going to do with their information. And it doesn't have to be written. This, it's nice if you can get written consent, if you can provide written information about what you're doing and get a neat signature on it, but that's not absolutely necessary. Verbal consent is also acceptable. And something else to be aware of is this concept of researcher reflexivity, essentially that reflecting on your own role in the research. And again, this is very counterintuitive if you trained as more of a quantitative or a natural sciences researcher, where the goal is really for you to disappear from the research. You don't want to be present in it or part of it. It's completely different with qualitative research. You are there, you are the channel, if you like, that the work is going through, and who you are and how you interpret things and how your presence influences those discussions is really important. So think about this both when you're designing your study. For instance, if you're working with female participants, there may be certain topics that they would be less comfortable discussing with a male researcher. And then when you're analysing your data, think about it again. How did my presence influence the information that people gave me? So summing up, I hope that this has been useful, and something that I would just emphasise is the value of that mixed methods approach of combining your qualitative and quantitative findings. There's really good evidence that the most persuasive information that is presented has a combination of statistics and stories. You can both say, well, 40% of people do this, but then you can also include some more detail about the impact that had on an individual, how it's changed what they do. I would say if you're going to go out and give this a go, you can't go too far wrong, but do be aware of any potential harms and consider that in your study design. Don't be afraid to give it a go, and it's all about practice. I still feel that every time I go out to do a project, I'm learning something completely different. If you are going to involve someone with more experience of qualitative research, I would say involve them right from the start of the project. I've been in this position where you're kind of brought in later on and you think, oh gosh, if I'd been here earlier, I might have just suggested doing things a little bit differently. And finally, I've given you a very, very basic overview today. This really is sort of scratching the surface of what is an enormous topic, but there are so many fantastic resources out there. Don't be afraid to go out, talk to people, see what's available online, and just give it a go. So thank you very much for your attention, really appreciate it. And if you've got any questions, I think we've got a couple of minutes to answer those just now. Thank you.
Thank you, Katie. That was a fantastic overview. Really great to be reminded about the power of qualitative data and using it in mixed methods approaches, and that we shouldn't be too daunted, using qualitative data. So we're actually going to hold off questions just now until after our next and final little session, which your presentation, Katie, leads us on to nicely. So I'm just going to introduce our next session, which is, we're really excited about this. We're going to show a short video clip, which is part of a longer video demonstration. And this video is a production of the SheVax project, which is supported by the Livestock Vaccine Innovation of the IDRC Canada and SEBI Livestock. SheVax is an action research project to support women's agency and empowerment in livestock vaccine distribution, delivery and use in Kenya, Rwanda and Uganda. Both qualitative and quantitative methods of data collection were used in the project. The qualitative methods, such as focus group discussions, key informant interviews and stakeholder meetings, were essential to understand the underlying causes of women's disadvantage in accessing livestock vaccines, information and other inputs. So the video is for training new facilitators to probe deeply but respectfully into unconscious gender assumptions among men and women and how they impact women's ability to raise and benefit from healthy goats and chickens through appropriate vaccine use. So Gretchen Walsh has led on the production of this video demonstration with the help from staff and students at the University of Malapit's Faculty of Veterinary Medicine. Gretchen has a background in biochemistry and biomedical research and has worked on various research projects in the United States, East Africa and India, focusing on neglected tropical diseases, particularly soil-transmitted helminth. She's recently completed a master's in global health delivery, focusing on gender, sexual and reproductive health from the University of Global Health Equity in Nairobi, Kenya. Gretchen's experience in both quantitative and qualitative data has led to equity-focused research, and she's done a fantastic job leading on this video, demonstrating the facilitation of the focus group discussion with some key gender messages. We hope you enjoy it.
Why do women raise backyard chickens and goats? What are the benefits to women and their families?
Women raise chicken in order to sell, in order to raise some money, to buy cooking oil and soap.
You see, in our culture, the man is the head of the household and ordinarily manages all the finances, but it's not always available when women have these moral needs.
Women like to have a small amount of money of their own because they don't like to ask their husband because he may get annoyed, especially if he doesn't have much.
Do women need their husband's permission to sell an animal?
You see, in theory, yes, because women control the household finances, but you see the value of a chicken is too small. You do not care about it.
Sometimes women demand money from the chicken, because we know the likelihood of spending that money.
And it's our right to spend it as we find it fit.
Let's talk about that. Why is it your right to spend the money as you see fit?
Well, the husband is the one who understands about the household needs and how to interact with the community. And a good man is the one who is benevolent and protects and supports the family, but does not demand money from the small-scale family.
It's true, but not all men behave responsibly, and they are not accountable to their wives about how much money they have or how they spend it.
You see, but that is because women only know how to stay at home and don't know how to make big financial decisions or even the big costs to maintain the household, like the repairing of a roof alone.
I think ladies know the cost to repair a roof very well, especially if it leaks onto their children.
Do women and men have spend money on different things? We have heard that women spend money on cooking oil, on soap. What else do they need to purchase?
Other food that's not available in the household must be purchased, even the clothing as well.
And school fees, if the husband doesn't give it to her. And even school supplies, such as pencils that the children need.
And medicine when the children are sick.
Okay, that sounds like a lot of responsibility. What else? What does the father buy?
The father of the husband also buys any building materials such as the bricks to expand the home, or sometimes even the wire for fencing.
Although the women's groups make their own bricks and added a room to the school last year.
The man must also buy agricultural products or supplies like the seeds, shovels, and even the wheelbarrow.
And what about personal items? Say beer, nice clothes, new shoes.
It's also important for a man to be respected in the community. So he needs to look successful and to drink with other men, when we are discussing or when they are discussing important village matters.
But we men do not discuss these private purchases and with the women because they will start to demand them too.
Let us not forget about the animals. Men really care about their cattle. They buy food and medicine for them to be very healthy. But it's very hard for you to see a woman buying food or medicine for the cattle. But there's nothing which is preventing them from doing that.
Do the women buy medicines for their chickens and goats?
No. You just see them use all herbal remedies or even ask the traditional healer for some prayer to help their animals.
You see, the ladies are worried about their animals, but they don't know what to do for them.
Thank you so much, Gretchen. I think, yeah, we all think that this is a really lovely demonstration with some key points of both how to facilitate a focus group discussion as well as some key gender messages. So now we're going to have, we've got a little bit of time for questions about video or for Katie. You can put them in the chat or hands up, and Annie's going to help take questions.
The chat is extremely quiet at the moment. So does anyone have anything they'd like to ask a question or say something perhaps to bring out one of the points that Katie had brought up or that came out in the video? You know, anything that either echoes your own experience in the field or contradicts it. I cannot see. At the moment, I cannot see. Feel free to stick something in the chat. And Evelyn, good, glad you liked it, since this was from IDRC's project.
I actually had a quick question for Katie. From my experience, it's quite difficult to not be biased in your selection of participants. Is there any kind of way that you can kind of guarantee that you get a range of different people, or do you use different methods for recruiting?
Again, and I think this is kind of standard answer in qualitative research. It depends. It depends what your goal is, really. A lot of the time, do you want as broad a perspective as possible? Do you want lots of different people involved and to get lots of different perspectives? Or it might be that you really want to know about the views of a very specific group, in which case, you know, recruiting people that fit that profile would be entirely appropriate. So it's not really like a quantitative survey where you'd be trying to sort of get a representative cross-section of your population. It's kind of what do you want to know, and it's speaking to the right people to try to achieve that. I hope that makes sense.
Yeah. So being quite selective about who might have knowledge about what you're trying to find out.
Yeah, absolutely. I think too, the term bias, other qualitative researchers might disagree with me, but I think often it's not necessarily a particularly appropriate term in qualitative research, because inherently everything we do it's all about bias, really. It's about participants' biases. It's reflecting on your own biases as the researcher. So I think it means something very different, I would say, in a quantitative context.
Okay, thank you very much. We're actually running out of time, and so thank you, Katie, for your presentation. Thank you, Gretchen, who's not with us, but she will see the recording later, for her efforts with the putting the video together. Thank you to all of our speakers today, and everyone who stayed on. I know it's getting quite late in the UK, and it's even later in other parts of the world, but we're going to continue the conversation on how to benefit women in our next COP meeting in a month's time. So we hope to see you there. And please let us know what you thought of the session in the chat, or talk to us using Brain Date, or talk to amongst yourself. We do have a group Brain Date coming up tomorrow at 12 noon UK time, so please join me on the platform if you want to discuss more. Maybe to share some experiences of how you've measured or used data that you've collected to benefit women in your own project. So if you don't manage to squeeze onto this discussion, please feel free to create your own. So thank you everyone for coming and staying with us through the talk. Thank you very much. Bye.